Young people are expected to be the most affected by the impact of the coronavirus on their education, careers and their future. The survey from the ANU has found a 60% increase in young adults reporting severe psychological stress. Here's Professor Ben Edwards from the ANU Centre for Social Research and Methods. Hi there, Ben. So this study compares mental health data before and after the pandemic. Did its results surprise you?
Yes, it did, Ros. So what we found is that 18 to 24-year-olds' levels of severe psychological distress increased from 14 to 22%. So that's about a 60% increase. And then for those aged 25 to 34, the increase was 12 to 18%. And these increases were the only increases really across the population. Older age groups, their levels of psychological distress did not increase. And the interesting thing about this is when we compared levels of psychological distress in Australia to the US, we found that the levels of psychological distress for young people was on a par, but for older Australians, they were doing much better.
So what does severe psychological distress mean?
Severe psychological distress is measured through the Kessler-6 screener, which is really a self-report question asking people a series of questions that's linked to threshold levels of mental health. So it's at risk of having clinical levels of mental illness. So
for this 18 to 24-year-old age group, what are the main causes of the increase in psychological distress?
So the statistical modelling that we've done suggests that fear of the COVID-19 virus and worries about it is one factor, concerns about infection is another. And what we've also found with this particular population is that they're the most affected by job losses. And so this is likely to be another driver of poorer mental health outcomes.
So the pandemic really is affecting young people at the point in their lives where they're trying to establish themselves in work and education and financially. It puts all of that in doubt.
That's correct. So we know from previous economic recessions, such as the Great Recession that occurred overseas, that young people who are in transition from school to work can potentially be really quite affected by this, and not just at the point in time, but also over the course of their lives. Their earnings can potentially take a dip. Not just at a point in time, but also long term. And what we're seeing here is the mental health implications of that. And for those people who are at risk of mental health at one point in time, they're more likely to be at risk of mental health problems later on in their lives as well. So policies and services that target and support young people are going to be really important for the time ahead.
So how does distress among young Australians compare with young adults elsewhere in the world?
So the distress is the same, more or less, with young adults in the US. The US data was from a nationally representative survey from the Pew Research Centre with over 10,000 people surveyed. And it was collected more or less at exactly the same time. And we compared levels of loneliness, levels of depression, nervousness, and so on. And we found very similar levels for young people. But as I said previously, for older people, we see a quite different pattern with older people in Australia, older Australians doing far better.
Okay. So Ben, how can young people be made to feel more hopeful about their future?
Yeah, so we did look at hope, and we found that on a whole, Australians are more hopeful than their US colleagues. And we found that hope was actually a really important stress mitigation factor. So we found that for those young people and for those people more generally that had higher levels of hope, they tended to have lower levels of psychological distress. So giving people things to aspire to, the opportunity to have a job and so on, those sorts of things are going to be really important going forward. Forward in the future.
Professor Ben Edwards, good to talk to you. Thank you.
Thank you.